Miss Robinson. My name is Evelyn. I will be your nurse today. I'll be helping you get ready for the Mohs surgery, which is a gold standard treatment for basal cell carcinoma, which is a very common type of skin cancer. Now, do you have any questions for me in regards to what basal cell carcinoma is, or even the Mohs surgery? Okay, yes, of course. I'll be happy to answer your questions. Now, this type of cancer starts in the epidermis, which is the outer layer of your skin, and it is caused by ultraviolet exposure, UV rays, over a prolonged period of time. So because of the fact that you grew up near the beach, which often has a lot of skin and sun exposure, as well as you having fair skin, it's very common for this kind of lesion to develop on sun-exposed areas like your zygomatic bone, which is your cheek area. Now, as for the Mohs surgery, your dermatologic surgeon, Dr. Williams, will perform a microscopically controlled excision. This means he will be removing very thin layers of your dermal and subcutaneous tissue one at a time, and he will be checking each layer under the microscope to be sure all the cancer cells have been removed and are gone. So this is a very careful process, which will remove the malignant tissue while keeping as much healthy epithelial tissue as possible. So that is the explanation of what the Mohs surgery is, as well as basal cell carcinoma. Yes, of course. So when the surgery is happening, you'll be on local anesthesia. So you'll be awake, but you'll be comfortable. That area is going to be completely numb. You won't feel anything at all. And depending on how deep the cancer goes, the procedure can take 1 to several hours, because we want to be very careful in removing all the cancer cells. Okay, yes. So what is it going to look like after the surgery is done? Now, after the cancer is all removed, the surgeon will close the incision with sutures and place a sterile dressing on that area. After the procedure, we'll go over your post-operative wound care. That includes gently cleaning the site, applying antibiotic ointment, and protecting it from the sun. We want to make sure we protect that area, because following these instructions will not only help reduce erythema, which is the redness of your skin, but also prevent infection and support proper healing. Now, I will say some patients that undergo this procedure, depending on their site and the depth of cancer that was removed, might have some scarring, but that is why we really want to make sure that we are doing the best post-operative wound care. But I do want to let you know that is a possibility. So as long as we are following the steps, which will be your post-operative wound care instructions, we will try to make sure we monitor your progress closely. I will say there is going to be some mild swelling in your cheeks or your cheek area, which is completely normal. But that is why it's very important for us to schedule a follow-up appointment within 7 to 10 days after the procedure, for not only for us to remove your sutures, but also to check your incision and how it is healing. Do you have any other further questions for me? No? Okay. Now I will need to ask, does next Thursday morning work for you in regards to doing your follow-up appointment, or would you like for me to schedule a different date? Okay, perfect. I will go ahead and go in and put that Thursday morning works for you. And thank you so much. We are going to go ahead and get you ready.